Nasogastric tube feeding procedure. The nasogastric tube feeding procedure involves the following steps. 1. Gather equipment. Collect all the necessary equipment, including the nasogastric tube, syringe, lubricant, a cup of water, tape or tube holder, and a stethoscope. 2. Explain procedure. Explain the procedure to the patient or their caregiver to ensure understanding and cooperation. 3. Prepare the patient. Position the patient in an upright or semi-upright position to prevent aspiration. Provide tissues or towels for any secretions. 4. Wash hands. Ensure proper hand hygiene with soap and water or hand sanitizer. 5. Measure tube length. Measure the nasogastric tube from the tip of the patient's nose to the earlobe and then down to the xiphoid process to determine the correct insertion length. 6. Lubricate the tube. Apply water-soluble lubricant to the tip of the tube to aid in insertion. 7. Insert the tube. Gently insert the tube through the patient's nostril, directing it towards the back of the throat, and have the patient swallow to help guide the tube into the esophagus. Do not force it. 8. Confirm placement. Use a stethoscope to auscultate for air or use a first strip to check gastric aspirate to confirm placement in the stomach. An X-ray can also be used for confirmation. 9. Secure the tube. Once placement is confirmed, secure the tube to the patient's nose with tape or a tube holder. 10. Administer feeding. Attach a syringe to the tube and slowly administer the prescribed feeding formula. Monitor for any signs of discomfort or complications. 11. Flush the tube. Flush the tube with water before and after feeding to prevent blockage. 12. Document. Record the procedure, including tube placement, type and amount of feeding, patient's tolerance, and any complications. 13. Monitor. Continuously monitor the patient during and after feeding for any signs of aspiration or discomfort. 14. Maintain tube care. Regularly assess and maintain the nasogastric tube and its placement to prevent complications.